Okay. Hello, ladies. Welcome. I am so excited to talk to Dr. Nicole Rankins. She is a longtime friend of mine. We go way back to residency.
Way back.
Way back, but she is an amazing woman, and I can't wait for you guys to meet her. I first want to mention again that these lives go to my podcast, Ignite Your Power podcast. So all these episodes will be onto the podcast later on this month. So welcome, Dr. Nicole Rankins. Your bio is amazing. You have a Bachelor of Science. You also have a Bachelor of Science in Mechanical Engineering.
Correct.
A Master of Public Health, an MD. I feel like you've gotten every degree that there is possible. An integrative medicine health coaching degree. It's like, my gosh, what have you not done?
I'm done though.
Be an astronaut. I think that's about it. You have everything else covered. And she's here to talk to us about giving birth your way and just talking really about being a birth advocate. You have such a unique role in that you're not only an OBGYN, you understand birth, but you also amazingly are advocating for women and helping them have a fantastic birth experience. So welcome very much to the Facebook Live.
Well, thank you for having me. This is so wonderful to be here with you. I can't believe how many years it's been since, we were together back in the hallowed halls of Duke Hospital.
I know. Crazy, huh?
Oh, crazy indeed.
So tell us how you got it. I mean, obviously we know that you love science. So how did you get into this particular thing with being a birth advocate?
Yeah, I think a part of it sort of came with my evolution as a person and like working on my own personal growth and trying to be kind of the best person that I could be, using my own gifts, talents to be the best person I could be. And it sort of led to some self-reflection about my work and what I'm doing and making sure that I am showing up in a way that feels good and, both for me and the people that I take care of. And I was in academic medicine, and that just wasn't the right fit for me for a number of reasons. And then I left academic medicine in kind of an ugly-ish way. But it ended up being one of the best things that happened to me. I sort of stumbled into a hospitalist position where it was like I was in, my husband was like, we're not moving anymore, so you have to find a job here. And literally, I was at my own OBGYN appointment, getting my own checkup. And my own OBGYN said, I think there's a hospitalist position opening up at our hospital. She didn't, we barely knew that I was looking for anything, and it just sort of flowed into the conversation naturally. That's how I ended up being a hospitalist. And then just part of that sort of being a better version of myself and then bringing that to work. And it just kind of led me to think about the ways that we were treating women and caring for people, and realizing that we don't exist in a culture that supports us really putting that woman or that birthing person in the center of her experience. I would love to say that I was always like this as a physician, but I wasn't. God knows I rolled my eyes at however many birth plans and, jokes, you're going to end up in the OR and all of those kinds of things. But just kind of that growth and reflection, realize we can do better. We need to do better. And it's actually not that hard to do better.
Yeah, I think that's what's so unique about you is that you are advocating from a physician standpoint, client standpoint, because you've had children yourself, and you bridge that gap that we really have lost. We've sort of gone in medicine to these 5-minute visits for OB, 10-minute visits for OB, and we really miss that component of being the advocate for the person until they go to deliver, right? And then suddenly we're like, oh, okay, what do you want? How do you want this to work?
And medicine also is unfortunately really slow to change. But I think that when patients can help ask the questions and come into the experience with information, what questions to ask and how to create that connection and that human sort of connection so that they're empowered to have the experience that they want. I really focus on helping women have that education piece and learning how to really empower themselves with information.
Yeah, and that's the piece that they don't have necessarily in the physician office because of time and just the ability to sit down and talk about what they want. And so you provide that information that's safe, right? Safe birthing options that they can then get an experience that they want, which is great.
100%. Yeah. Yeah.
Yeah. And I saw that you help women kind of talk about a birth plan and how to do that. And I think that's unique as well as an OBGYN, because I know you mentioned we do tend to kind of go, oh, a birth plan, but a well thought out birth plan is actually very helpful in labor.
100%. And really what I teach, and like I said, I used to be like, oh my God, birth plans, but really it should be an opportunity for that the woman and her doctor really to discuss what she wants for her birth, and then look at that in the context of her own pregnancy and her health, and kind of look at that on an individual basis, so that by the time you're getting to the delivery room, you have an idea of what to expect. You know what you're looking for. You've talked about, you know what, hey, you have hypertension, so maybe it's not, you're not a good candidate for something like intermittent monitoring. And so they're not surprises when you get to labor and delivery. It's really so much more than just like checking off, I want an epidural or I want this. It really should be a conversation starter during pregnancy, so that everybody's on the same page for what the woman wants for her birth. And she knows if she has people that are willing to support her for what she wants for her birth. I found, unfortunately, that not everybody practices the same way, where they believe in choices. And unfortunately, some of us aren't doing the right thing. So you want to find that out as soon as you can, and then work, and then, so you have time to find someone who is doing the right thing.
When do you typically tell women to look at the birth plan? Is it then must be earlier on in pregnancy that they can find the right person?
Yeah, I usually say, I say anytime after, once you get into the third trimester is something you can start thinking about and talking about, because it gets harder to change doctors as you get towards the end, just because of the logistics of it. So, anywhere after 24, 25 weeks, these are some things. And it's not necessarily like a one visit thing. That's also something that I teach. Visits are short. You can always say this is the start of the conversation. We can finish it at the next visit. But just to have that conversation so that, again, everybody's on the same page. And I find that doctors who want to do the right thing, they actually find that they're very receptive. They come back and say, oh, my doctor was like, thank you for asking the questions in a way that wasn't accusatory or anything like that. To have those conversations, it helps everybody feel better about the relationship.
Well, you provide also the ability, I think when someone brings a birth plan into me, the thing I like about going over it is to say, well, you may have read this is a great idea, but maybe this is a better idea, or maybe we can talk about a safer alternative for you. And so you provide that knowledge for women to go through their particular, what they think they want, and know, is it something that actually makes sense, or is it something that's, potentially they're going to be disappointed, because you don't want them to be disappointed as well.
Right. Exactly.
For sure. That's part of, I think, why people make birth plans, is they have those expectations of what it's going to happen, how it's going to happen.
Yeah, and I say birth plan, and I say that because that's what people say, but the first thing I say is that we have to actually stop saying birth plan, because none of us can plan birth. We doctors, we think we can't plan birth. The patient can't plan birth. The baby has all the control, and they don't tell us what they're going to do. So we think we can control things. We can try with labor induction, all of these things, but there's no guarantee that we can make any specific outcome, necessarily happen on any specific day. Even a scheduled C-section, sometimes your water breaks beforehand, or, labor starts. So really it's birth wishes and the things that you want for your birth, because we can't plan birth. And really it's about helping people deal with that unpredictable nature of birth.
Yeah, and also understanding what are your options, because nowadays, I'm sure with COVID, so many people couldn't go to birthing classes or really do anything I know our hospital had shut down quite a bit on their classes, so you probably provide a little bit of a birthing class as well.
I do. I have an online childbirth education class. So yeah, for sure, which definitely so many people found helpful during COVID. 100% that they had this option that was available, and definitely during COVID, people didn't have we sort of lost the ability to have more people in the room. It's only one person. You barely even get two people now. So I think that that's going to stay actually probably for a while. So it's really important that you have that information and that knowledge going into it.
Will you tell us about your birth class?
Oh, sure. Yeah. So it's called the Birth Preparation Course, and it is entirely online. It is about 10 hours of content, actually. And the first part starts off with just like really the very first lesson is mindset and how you approach your pregnancy and your birth from a mindset perspective, and the things that we do to work on ourselves, like meditation, affirmations, exercise, those type of things to really help get that mind space in the right place. And then support for your birth. Things like how your environment around you makes a difference, like the labor room, making it feel more comfortable. We all know that we all feel better when in an environment that feels good. So just those little types of things. And then I go through, of course, all of the details of labor and birth, the stages, dilation, all of those things, position changes, how to manage pain without medication, epidural. Some of those things that you need to be prepared for just in case, like episiotomy, assisted delivery, cesarean birth, and just questions to ask along the way so you feel like an empowered participant in your birth. And then, of course, the postpartum period. So what things to get off to a great start postpartum. Something that I found is that, and it actually, as physicians, we at OBGYN, sometimes we have this thought that women like will sacrifice everything to have this particular image for or what they think what they want for their birth. But really what I find is that people are able and they're comfortable with the outcome as long as they feel like they were involved in the process. So if they feel like they were involved and you talked to them and you respected them and their wishes and they explained things, then it's fine if it comes to a cesarean section. It's not that people, I have rarely, if ever, maybe, once or twice in 15 years met somebody who would do something to sacrifice their health or their baby's health. Like that's just not actually in practice a common thing. So just really giving people that information to how they can be informed participants in their birth experience.
I agree. I found that the times when people were disappointed about ending in a C-section or had thoughts about how it was a bad thing, it was really based upon anxiety about how it was going to go, and will I not be able to hold my baby the way I would when I was having a vaginal birth. And so when I sit down, before a C-section, as long as the baby's good at tolerating that, we kind of talk about like, what are the fears about a C-section? What is the thing that you think is the worst thing that could happen? And let's kind of go through that, because sometimes what I think is the worst thing that can happen is not what they're thinking at all.
Yes.
And I could answer a very simple question, like, it could be about getting stuck in the back, or it could be about, a lot of times it's mostly,
like some people,
mostly it's about the ability of holding the baby right away. And now with skin to skin practices with C-sections, we can give them almost the same, time that they can, just like on a vaginal birth.
Yeah, it's like you found that so much of what we do can be, just alleviated by talking and having conversations. And I help give women the information so they can help start those conversations, even if their doctor isn't.
Yeah. So do you encourage women then, if they have particular things that they want to discuss, to bring them to the appointments with them to their doctor? Yeah.
Yeah. Write it down. Bring those questions. Just say, and I always encourage people to humanize the situation. So say, I'm concerned about, or I'm scared because, I'm scared that I'm going to have a C-section, or I'm scared that if I'm a Black woman, that I'm scared about the risk of dying during birth. Tell people how you feel and make that human connection. I think on the other side, doctors, we are human beings and we respond to that. When we hear people say those things and we hear those feelings, I think it causes us to stop for a minute and really look at that person as a human and not like the next patient, which can be easy to do. Our system is there's on our side of the system, we have problems where we don't give physicians the space necessarily to care for folks the way that we want to. So it can be tough on both sides.
Yeah, and I find that as a physician, I sometimes think I know what the issue is, and then someone starts talking to me and I realize I was completely wrong. That what I thought they were concerned about was not really what the issue was, is that I just needed to ask the question, like, you know, what is it that, you know, why do you want a delayed cord clamp? Or what is when you've read about this online, what does this mean to you? So I understand maybe there's a safer option, or maybe this is the best option.
Right. Yep, 100%.
Yeah, I think, you know, you must be a great resource for OBs as well, because they can just say, go take Nicole's class. She's fantastic.
I have been nicely. It's nice. I have a few people who tell me that my course was recommended by their OB. So that is, I do try to be a resource. Not a try. I am a resource of really solid evidence-based information. So, you know, sometimes when people say like, if people say things like, I've had 3 C-sections, like I'm not going to tell you that it's okay to try for a vaginal birth after having had 3 C-sections. You know, like I'm not going to do that. We're all evidence-based and clear, but you know, ultimately I tell people you can make the decision for yourself. Here is the information.
So you do talk to some women about home births, I would imagine, that have
taken
classes.
I say very clearly that my lane is hospital birth. I don't know I've never been to home birth. I don't know home birth. I know that home birth is an appropriate option for people who are low risk and in settings where the home birth provider is well trained, and when you have good backup systems, so people can get to the hospital quickly. I mean, in other places in the world, that's how home birth is done in a lot of ways. It's as long as the system that's very open and communicative. On the West Coast, they do home birth a lot more than we do here on the East Coast. So it's for appropriate candidates, but I don't go into that space because it's not what I know.
Yeah, you actually said something really important, because there are states where we were both in North Carolina for a while, where you can have lay midwives that don't necessarily have formal training to be able to be at a home birth. So it's important for women to, if they're going to deliver at home, to make sure that they've looked into their provider helping them to make sure that they have the appropriate training and skills.
Yes, 100%. The skills, and they should a good home birth provider. We got some in my area in Richmond that are very good, very experienced, carry all the things in the car, know when to bring people in the hospital when things happen. They should be asking you questions to make sure that you are a good candidate for home birth. And you should very clearly ask, what happens if I need to go to the hospital? Or they should be bringing that up. Again, birth is it is unpredictable. You cannot predict what will happen. So you need to have those systems in place.
Yeah. And even in a hospital birth, what is backup plan? If you feel uncomfortable with your provider, what options do you have? Sometimes that rarely happens, but every once in a while you have the on-call physician you're not necessarily comfortable with. So what is the backup plan in your group? You know, in your model, I guess it's a little different because you're a laborist. So you are the person that's.
I am the person. Although if they don't like us, then we just call the private, their on-call doctor. We take over at our particular hospital for all of the groups at night.
Yeah, so maybe people don't know about because I'm in the middle of the country and we have very few laborists. Like St. Louis and Kansas City, larger places have them, but where I am, there is no laborist model. So will you just mention what that is?
Yeah, so I work just in the hospital, so I don't have any office responsibilities at all. I will never go back into the office. Actually, I like what I do as a hospitalist or laborist. 99% of what I do is deliver babies. So I do 24-hour shifts at a time, and whoever is there, I take care of whoever is there. And it has its pluses and minuses. The pluses are that for patients, it provides a system where there's not a rush to get patients delivered. Nobody's trying to go home. It actually has been shown to decrease cesarean birth rates when you have hospitalists because that pressure isn't there. It's also safe, or maybe even safer to have a physician in the hospital 24/7. You're not waiting for someone to come in from home if there are any type of emergencies, especially in hospitals that have a higher acuity of the type of patients that they see. So That's the benefit there. The minus, of course, is that people are meeting me for the first time. So I have to work to quickly establish that trust and let them know that we're, here to take care of them and the things that they want for their birth. So that's the downside, is that if you have a hospital system with the hospitals, you won't have met that person beforehand. But I find that most people still have a great experience with their birth.
Yeah, I think in the end, they want somebody who's just knowledgeable, who cares.
Yes, yeah, pretty much, yes. And who looks at them in a more holistic way. Like the floor is like everybody is physically healthy. Like that's basic. The baby's physically healthy, mom is physically healthy, but we can do better and make sure that like mom has a good like emotional experience as well. So that's I think what people want, like more of that, like you said, like you care. That's what that having helping people get that emotional experience is about.
So for the clients that you work with, what do you think is the sort of biggest obstacles that you guys have to overcome together? You said something about African-American women worrying about delivery. I mean, there is a higher rate of maternal mortality and morbidity. Mm-hmm. Do you think that that's a lot of population that you work with that has fears of the healthcare system in general? Or do you think most people are just nervous about having a baby?
Yeah. A lot of people are just nervous about having a baby, not knowing what to expect. I mean, not that long ago, 100 years ago, everybody gave birth at home, and you would see your sister being born, or you would be around, you would see your mother in labor, so you had some more experience of what birth was actually like. And then as it got moved into the hospital, and then quite frankly, more and more men getting into the field, it was like more of misogyny approach, and women can't decide what happens, and we just, you get knocked out, and we pull babies out with forceps, and we cut episiotomies without telling women what we're doing in their bodies and those kinds of things. So we went through that thing. So people have that history in the back of their mind of those real instances where people were mistreated, and then the fear of really just not being listened to and not being respected and not having someone care about them. And unfortunately, that is grounded in some reality. I personally saw circumstances where, it's like hearing like such and such has an episiotomy rate of 70%. It's like that should not happen in modern day. Mm-hmm. Or like breaking someone's water without like telling them first that that's something, or stripping membranes without like telling people. So much of it is just really tiny things of just ask and discuss things before you do things. So, and it's not everywhere, obviously, you wouldn't just decide like, I'm just gonna break your water and not talk about it. You can fathom like doing things without having a conversation. Yeah. But unfortunately, I believe women in the stories when they say that happens to them, and it does happen.
Yeah, I do think that's or making them wait for an epidural. That drives me crazy when I hear about patients who are like, yeah, they said I had to be 6 centimeters. I'm like, who said?
Like you want it? Okay.
Yeah. I'm like, the data, even in anesthesia literature, says it's fine. So it's fine to get it when you want to. So yeah, I mean, in healthcare in general, you should always have an advocate with you in any birth. I mean, it could be having your gallbladder out. Like, I think it's important to have people who are there on your side, because there are errors that occur. There are things that understanding true informed consent can be difficult depending on who you are and what cultural background you have. Yep. So it's important for everybody to have somebody with them advocating. I think especially with birth, it's probably been very challenging this last year with having your, limited human beings. I mean, we all love our husbands, but sometimes they can be not quite as helpful. In the birthing processes, say our mom or a doula.
Yes, exactly. And patients don't know how to, it's because I think sometimes OBs get offended. Like they're like, I don't understand why my patient doesn't trust me in a way. And we have to realize that we have to earn that trust and demonstrate that we're trustworthy. We can't just expect that people are going to trust us just because we have an MD behind our name. We have to earn it and just demonstrate that we're worthy of their trust.
And that we connect on whatever level that's why patients have the choice to pick providers that they are comfortable with, because sometimes they may not like my style. They may prefer to see somebody else that communication is better with them because their styles mesh as well.
Exactly. Yeah.
So what would you tell the first time parent that they need to do, besides take your course, of course, but what should they be thinking about actually as they get pregnant and they're kind of getting finally through the first trimester and the misery of being tired and all that stuff? What are the things that they should be thinking about as far as getting prepared?
Yeah, I think 100% everybody has to do some sort of childbirth education. Like back in the day, I think it was actually done more, and we kind of got away from it as a society, and we're doing all this. But whether it's my course or another course or whatever, do some sort of childbirth education to educate yourself about the process. Don't go into it blind and just sort of trying to figure things out as they go. You'll feel better about things if you do childbirth education. So that's number one. And then the second thing that everyone should do, that I know I certainly was guilty of not touching this when I was in the office, but start preparing for the postpartum period when you're in your third trimester, because postpartum is, the way our medical system is, you're not going to get that support from the medical system. Typically, you may have a visit like at 6 weeks, and a whole lot happens within that first 6 weeks. ACOG is getting better, and they've said, actually, it's been several years that they said we should have a touch point sooner than that. But start getting yourself familiar with what happens postpartum and having things lined up for when you need to reach out and get help. It doesn't have to be, you're not going to understand everything about having a newborn, but you want to know, like, okay, like I have my pediatrician lined up, or I have my girlfriend who I can call about this particular issue, or, I have a lactation counselor who I can call when I'm having trouble with breastfeeding. Try to get some community and have like a postpartum plan, so to speak, so you're not like flailing once this baby is born. We work a lot to get people to the birth part, and then it's like postpartum, here you go. So, and I know I felt like I have this tiny human being, and now I'm supposed to take care of them. Like, what am I supposed to do? So just think about that postpartum period sooner than you think. Even like a doula, if you can pay for like a postpartum doula once a week, it can be like life-changing to help you get some rest one night a week, those kinds of things. So that would be the two biggest things, like childbirth education, thinking about the postpartum period while you're still pregnant. And then I guess the third thing is always have someone with you who can advocate for you on your behalf, like we were talking about, just because sometimes in birth, you may not be able to speak for yourself, whether you're in pain because of the contractions or the labor, whether you're just not feeling well. If you want to have somebody there who's comfortable speaking up and advocating for you on your behalf.
I think you mentioned something really important, the fourth trimester, that postpartum time. We do, in the medical system, definitely have failed women in this part, because so much happens once you take that baby home, not only from an emotional standpoint, but a physical standpoint. Your body is so different.
Yep.
You don't really know if it's normal. Like, it's all just kind of a whole lot of changes at one time. And you're at the same time trying to be able to feed this little human, but also try to get some sleep, but also, it's so much. And I think that is critical, that we really should spend more time with women, trying to tell them, like, hey, if you have, problems with bleeding, you need to call us. If you have issues where you are crying on the couch and you don't want to feed your kid, we need to hear from you. We don't give them a lot of warnings as to when to call us and when to contact us. And it's okay to feel like, things are all different down there.
That's one of the biggest things, is like telling women, like, we're not trying to scare you, but it's okay that you're going to feel like a lot different, and sometimes overwhelmed, and sometimes like teary, and just when to know, like, that's normal versus like if it's stretching on and beginning to be a problem. But it's normal to sometimes be like, I'm not connecting with this baby right away, or it's taking, why does this thing cry all the time? I'm not happy. Like all of those things can be normal, and you're not a bad person. You're not a bad mother. It doesn't mean that you don't love your children. But that postpartum period, especially for the first, like, I would say month, it can be rough.
Yeah, I think till they start sleeping through the night, it's just rough the first 3 months because it's so. And I think unfortunately, social media does not help us as women because it makes us feel like everybody's got their act together except for us. They all take their beautiful Facebook photos and with the prepared dinner behind them and everything. Their house looks gorgeous, and it's like that's not what happened to me. I like peanut butter sandwiches for like a week. And like my mother came over and was like, "When's the last time you took a shower?" I was like, I don't know. I've been eating peanut butter sandwiches. I don't know. That's all I know. Like it's just so you kind of get stuck being a little isolated and kind of by yourself. Because I think most women kind of say, well, you just suck it up and become a good mom. That's the way it works. And you're like, how do I do that?
Exactly. Yeah, exactly.
How does this happen? Yeah. So does your course also provide some postpartum support as well?
Yeah, I do. I certainly talk about some things to expect postpartum and just how to get off to a good start postpartum for those first 6 weeks in particular.
Yeah, that's critical because there's so much that fortunately, when we see someone, they usually have bad postpartum depression or some physical symptoms that are just really interfering with their life. And it's good to try to encourage women to seek care before that happens, before they feel like they're by themselves.
Yeah. Yeah.
Well, and also you're a podcast host, if you want to mention anything about your podcast.
Yeah, so I have a podcast called All About Pregnancy and Birth, and I rotate between different types of episodes. I have women come on and share their birth stories, which is probably my favorite because I get to hear about it from a different perspective. I feel like I learn something every single time. And then I cover topics on episodes. And then sometimes I have, and then I also have guests who come on and talk about various topics. So rotate between those different types of episodes. We're about 2 years into, a little over like 2.5 years into it now. So.
Yeah, I enjoy your birth stories. I think it's nice to hear from other women their perspective of how it went and and you'd learn so much about what people prioritize as what's important to them and what they thought leaving the experience afterwards, what they saw from that. Because, when you have your experience in your head and then say 6 months or a year later, sometimes those things change as to what you thought was important at the time.
Exactly.
Yeah. So I've listened to a couple of those episodes and I think those are really interesting to hear from a patient perspective.
Yes. Exactly.
Well, I appreciate so much that you talked to us today. Is there anything else that you wanted to say?
No, other than thank you so much for having me. It is such a joy to connect with you again after all these years.
Yes, thank you very much for doing what you're doing for women. I think it's really important that there's a very knowledgeable, amazing advocate and liaison between both the medical field and clients to try to help them understand, have a better experience.
Thank you. Thank you.
Thank you. Well, I'm going to end the Facebook Live. I didn't see any questions. And then I'll just say hi to you afterwards, if that's okay.
Yeah.